Thank you. Well, President Biden has released a controversial plan to combat COVID-19, announcing new vaccine mandates that will impact roughly 100 million Americans. The president says he is frustrated with those who are still unvaccinated. Here's a breakdown of all the federal workers, which he wants, and contractors and healthcare workers that he wants to require to get vaccinated. Private sector employees for companies with 100 or more workers will have to either get vaccinated or be tested every week. The president also says the government will provide easy access to booster shots for those who already are vaccinated, and production of affordable at-home testing kits will be ramped up. Joining us now with more on the local impact is Donna Walsh. She is the health officer with the Department of Health in Seminole County. Donna, good morning.
Good morning, Andrea. How are you?
Doing good. So President Biden announced that he will work to make free testing sites more available. How would that impact Seminole County?
Well, Andrea, currently we have a number of no-cost testing sites available. We have throughout this pandemic response, and this is in partnership with our county and our other partners in the community. For instance, we have 4 sites that have been operational now for many months. That's our Altamont Springs Sunrail Station, Sanford Sunrail Station, the Museum at Seminole County History in Sanford, and the Redbug Lake Park in Castleberry. So, we're in close communication with our emergency manager daily, and if there's a need to expand those no-cost testing sites, we have plans to do so. So it would just be, usual for us, to, as we're accommodating the community for testing now.
Donna, Seminole County has really done better than many other Florida counties when it comes to COVID numbers, testing, vaccines. Why is Seminole County's approach compared to other counties working?
We are an integrated public health system, and every community, of course, is unique. I would say that, it's just that the strength in our partnerships, the constant communication, and the support that we get from our community and allied partners. So, I don't know that one county is doing necessarily better than another. We're all in this together, and certainly we're all trying to meet the needs of our unique communities.
And what about administering booster shots? I know that's going to be the next trend here. Where is Seminole County on the booster shots?
Well, Andrea, just to just give some information on what's available right now. As you know, the FDA approved emergency use authorization for what they consider a 3rd dose in a 3-dose series for those moderately to severely immunocompromised. And so our community is certainly offering those through outreach that's been ongoing since the doses became available, as well as our federally qualified health center, True Health, and the health department offering that vaccine. So we continue to provide that service. And in fact, we have another event scheduled for tomorrow, Saturday, at Winter Springs High School. So we will continue that effort. Now, the booster doses technically have not been approved till it's expected the end of this month. And that's for people who may have developed an adequate immune response to the 2-dose series, but the experts are finding that that immunity may be waning over time. So that recommendation for booster dose is about 8 months after you completed the 2-dose series for mRNA or 1 dose for Johnson & Johnson. This would be specific for Pfizer to begin with, from what we're understanding initially, but then would expand to Moderna, and we're just waiting on further information for J&J.
Donna Walsh from the Department of Health in Seminole County, we thank you so much for joining us this morning.
Thank you, Andrea.